All right, all right, all right. This is You Can't Make This Shit Up. Today we have Angelina Rahman, awesome, and of course Joel Hawksley, and I am David Washington. And it's Memorial Day weekend, right? Time has just passed so quickly. However, we still will put out this content every week. So please hit the notification button so that you know when our new content comes out. And please let everyone know that You Can't Make This Shit Up. The Morning Constitution, the David Washington Show, Countertop Politics is out there, and we are coming at you with so much content that we hope make your life better and is thought provoking. So, saying so, today our topic is get sick and forget about seeing the doctor in Florida. And
Sorry.
what's that, Joel?
I said, sorry, I'm going to still see the doctor because, I mean, we're going to get into a conversation. I'm going to be able to say all kinds of stuff, and I'm going to say, I'm going to see the doctor. So,
Right.
unfortunately, I am VA. So,
Yeah, exactly. So you've got no problem.
no, I don't have a problem with you guys.
However, and let's preface this by saying that it is now legal in Florida for doctors to deny health care to anyone if they feel like it here in Florida. And Governor DeSantis signed a bill that would give virtually any healthcare provider, including insurance companies, the right to deny care. DeSantis signed this bill about a week or so ago that will allow doctors and health insurance companies to deny care to anyone they want. Under the new law, in quotes, a healthcare provider or health payer has the right to opt out of participation in or participation or payment for any healthcare service on the basis of a conscience-based objection, meaning, end of quote, meaning based on their moral, ethical, or religious beliefs. Providers and insurers will face no consequences under the measure and will not be required to refer patients to a place that will provide the needed care. If they are penalized for denying care or coverage, the doctor or company can sue. Your thoughts?
Oh, I have a lot of thoughts on this because, look, with the abortion rights being sent back to the states, you have Catholic organizations that provide health care. You have, religious hospitals. I doubt that a major hospital is going to put somebody out. But what if there's something that they won't do because it's against their ethics or morals?
Mm-hmm.
I mean, it still says they have to send you in the right direction. You just read that.
No,
They must be able to provide it. Must be able to provide it somewhere else.
right. They of course can say, hey, we're not going to service you based on these beliefs of ours. So here's a referral elsewhere. However, they do have that right not to give you that referral also.
I didn't see that really. I mean,
I'll have to dig
you're
a little bit deeper into the law. However, what will stop a provider if I walk in? Well, before I get into what I think. Angelina,
Hmm.
what do you have to say initially?
So my initial thoughts, it reminded me of whenever the controversy between getting the actual vaccine mandates and how the different doctors were saying, yeah, we're not going to operate on this person because they didn't get their vaccine. And many Republicans were on the side saying, how can you do that? This could be a life altering procedure. And so now I feel like it's a little hypocritical now because now I am understanding towards certain situations. So, for an example, I'm a Christian. I wouldn't want to operate on someone that's having an abortion because that's against my beliefs, right? In that regards, I can understand, but you can also twist it. If someone isn't a Christian or if the doctor isn't a Christian and they're like, oh yeah, I'm not going to operate on this person because I don't believe in their beliefs, or Muslim people, or just any type of religion. I feel like now you're crossing it too much because we have so much diversity in this country, and they can basically just say, oh yeah, because you're this, I'm not going to operate, and
Yeah,
that's whenever I don't like that.
but I think these are extreme. Like I think
Joel,
these are.
Joel, I'm
Yeah, go
sorry.
ahead.
Can I clarify something in regards
Yeah.
to required to refer?
Hmm.
In the show notes, it does say that providers and insurers will face no consequences under the measure and will not be required to refer patients to a place that would provide the needed care.
Okay, I didn't get
So
that.
they're technically not required. I'm sorry, please.
No, that's fine. I mean, just you. Here's the thing: when you look at this and they use common sense, which I know Democrats don't do that right now. Okay, here's the thing: this is to protect somebody from having to do a procedure that they do not want to do, and protect them from, like, if you don't want to transition somebody, if you don't want to go through the step by step process of bringing somebody from male to female, female to male,
Hmm.
that doctor should not have to be that doctor,
Hmm.
right? And then to force that doctor to be that doctor
Hmm.
is what's happening right now. It's like, you're my clinical doctor, you're the one that I'm coming to see, and I'm over 18 now because in the state of Florida you can't do any transition, you can't do blockers because of the law. But this is more than baking a cake for a gay marriage, right? This is taking your ethical and moral obligation and saying it doesn't matter. You have to sin, you have to you have to sin to do your job. That's basically what they're saying. And Muslims and Mormons and every single religion, it's not going to be a mystery. Now we'll know if they're discriminating. We'll know if they're discriminating, and if it's not part of their religion, we'll know that. We'll know the hypocrites, and they'll lose all kinds of people because you can't say one thing and then do another, and that's going to happen. You're not going to be able to say, I don't do this, but I do perform abortion, right? I don't transition, but I do perform abortion. Well, how's that doctor truly going to be able to defend himself in the fact that I do one sin, but I won't do the other, right? Both biblically by that Catholic religion, they would be banned from doing either. Am I making sense? I'm hoping I'm making sense.
No, I mean, I completely agree with what you're saying. My only issue is the actual law itself because it's so vague. That's my issue. Now, the idea of the law, I'm in favor for it because if I was a doctor, I wouldn't want to do those things. I wouldn't want to put my religion on the line just because, people want to, transition or get an abortion, right? That's their right. I just don't want to do it. But it's how vague the law is. That's my only issue. And I feel like there are going to be people that's going to take advantage of that.
Yeah, I don't think this stands mustard when it goes to the court, but
I
that on that half.
I have a couple of perspectives. One as an individual and one as a mental health professional in the past. First, my views, my point of view, my thoughts, ideas are out here on the internet. And so people have access to what I believe in and what I stand for. My fear is that because we are in the digital age and that we all leave a digital footprint, that I go see a doctor at a hospital, nonprofit, a religious nonprofit, emergency care. And I'm there for an emergency reason. It could be life or death. A doctor or a nurse or the orderly, do they still call them orderly? Ooh,
Mhm.
showing my age. But the person wheeling me from the gurney,
They still,
taking me
do
from the
they do they
gurney.
still call them do they still call them candy stripers?
Tell me about it. Oh my God.
Never heard of these terms.
That's,
So I'm
that's
gonna.
going way back.
I'm just saying.
Right. I mean, it's someone taking me from the gurney into the emergency room. I worked in the emergency room. I've been there
Mhm.
for, emergency surgeries and
Mhm.
everything. And someone recognizes me and say, I'm not going to treat this person because I don't believe in, his, sort of liberal views. And they're like, I'm done. That is, it's an extreme possibility, Joel, but it is a possibility. Now, my second example here, which I think is a little bit more realistic, my past career life, I was a mental health professional, and so I did crisis counseling. And I did crisis consulting counseling throughout Northern Illinois. And I would come across people from different aspects of life, different religions, different genders, et cetera, et cetera, et cetera. And I was there to assess whether or not they were a danger to themselves or to others. As a mental health professional, working through the nonprofit mental health organization and the hospital organization in Northern Illinois, if I was still in that profession here in Florida under this law, if there was someone that I don't agree with in their lifestyle, in their beliefs, or their race, I could theoretically say, I'm not going to treat you.
But the law is not that. See, I'm with you on that, but the law is not going to contradict the law that protects you for racism. The race is going to
But,
be
but
it's
don't you
going
think
to.
I can make a good argument?
No, you can't, because the law protects you for certain disabilities and for certain things. I'm a veteran. I know what, I'm protected class on certain things, but
Mhm.
I also know that there are different time frames for veterans to have certain benefits. Like the Supreme Court just said, like if you don't initiate your medical within 10 years of getting out, you're done. There's no going back. There's no going back. If you don't do it, if you don't do something, you will not get the services. So everybody needs to know that within the first 10 years of getting out, you need to go to the VA, at least get seen. Because
But
if you don't, you can't get connected disability on anything.
but Joel, the VA is a government structure that protects veterans, and so there are guarantees in
But each
place
one of
there.
these
But if I
businesses,
go to like if I go to
yeah,
a
you can say it.
religious nonprofit
You go
hospital
to
here,
Advent. Let's use Advent Health, because Advent Health is a religious institution. I don't see them turning anybody away. I see them having enough people
not as an
in there.
institution, the individuals. Again, let's use my example again. As a mental
Right.
health professional, I'm doing the assessment in a religious-based nonprofit hospital, and
Mhm.
I come across someone that I'm doing the assessment. I've begun my assessment, and that person tells me that yeah, they grew up in a home filled with white supremacists. Based on this law, as a black man, and I'm not saying I would do this. I never did this. I
Right.
treated everyone that
We we
came.
I think everybody understands that you're just trying to make a point. 'Cause, I mean,
Yeah, I'm trying to make a point. It's just
I'm
that
not,
it's
yeah,
just
Nowadays, you
this
have to
is
clarify.
what was that, Angelina?
Nowadays, you have to clarify.
Right, right.
yeah, I understand,
And,
but
and, and so it's just so broad, Joel, and so dangerous in my eyes that it can be manipulated.
it's this is the thing. I don't see it the same way you see it. I don't know if this really passes muster in the court system. So don't get me. I'm not on or I either side right this second. But what I'm saying is, if we use Advent Health, for example, Advent Health, you're working for them, you don't do X, Y, and Z, they will fire you.
Mhm.
They will fire you because they have written right into their instructions that they're going to protect race, religion, all of them.
And they'll face
So
a lawsuit from me based on this law.
it won't matter because they'll have the civil rights laws of the federal government to protect them on why they let you go.
So
Because
we're caught up
you
in
because
litigation.
because they're going to literally say that you denied a person their civil rights. That's why you were fired. When you bring this law up, they'll say you weren't in private practice. Private practice over trumps the rule because it's only going to apply to the government. That's what's going to end up happening because it's going to be the civil. You're talking about the civil rights is going to overdo it. It's the federal law. The federal law is going to take this one and pull it apart. But what they're trying to do, the precedence is they're saying because they don't have to bake a cake for a gay person, that's why this law will hold mustard. It won't, because that's a different source. So I don't see this as, I'm not a lawyer, I'm not any of that, but I see this as one of those laws that just, why'd you waste your time?
Thank you, Joel. That's exactly the point I'm getting to. With everything that Floridians are facing, we've got another active hurricane season that is nearly upon us. Why push, why give energy to a law like this, to a bill like this? Angelina.
Well, I actually do find it very interesting. You both are right. There is no reason to prioritize this law over hurricane season. I mean, it's been raining pretty much every single day in Florida,
Mhm.
and even starting to flood as of right now. At least the areas that I've been in, not much of a flood, but a little bit of a flood. And so we should be putting our energy into that. But I must say, though, I mean, I think that it's an interesting discussion to have. What rights do healthcare providers and what rights do we have as people going to them? But it's just, it shouldn't be a priority as of right
Great.
There's a lot of legislation that we've done this time that, you know, I'm a Republican and I'm not blaming the Republicans, but sometimes there are laws, like I'm saying with this one, they don't make sense. They're only there to push the Supreme Court. That's exactly what this is.
Okay.
Another one of those laws that somebody's going to boom and they're going to have to send it up to the Supreme Court. Every law that we've made thus far in this session, I think, is built on let's be the precedent state. Let's be the one who pushes how much rights our state can get.
Florida is like the legislative or political experimental lab of sorts. It
Yeah,
seems.
didn't the speaker of the House say, yes, we're going to pass this law, but it's to go to the Supreme Court
Mhm.
because we do want it to be seen by the Supreme Court because we want a decision on it. I'm like,
Judicial
that's amazing. Now we're going to do these laws just because we want to see what the courts say. You want the
Republicans have
interpretation.
Republicans have mastered judicial activism.
Yeah, we never did before. That used to be
Right.
the part we always said, hey, Democrats, the only reason Democrats get anything accomplished is because they go to the court.
Right.
What I'm watching our state do is exactly what that is. Let's have the courts make a decision because the courts are in our favor.
Mhm.
Well, Roe v. Wade going back down to the states, that's a no-brainer because even Ruth Bader Ginsburg
Yeah.
had an issue with it, but she protected it. Don't get me wrong, she protected it, but she
Mhm.
also pointed out the dangers of it because it's not enumerated in the Constitution. If you're
That's correct.
watching Morning Constitution, you find out yes, the Ninth Amendment's there, but the 10th Amendment, which I'll talk about after John Micah's interview, that's going to be interesting because that's where, just because it's not enumerated, then they send it to the states. And
Correct.
each state can then govern itself because the only requirement is you must be a republic in your constitution. You can put anything else in your constitution unless it, unless it violates your enumerated rights in. So that's why when I talked about the ninth, I said maybe they should talk about the 10th at the same time because that's where Roe v. Wade is. And now our state has taken that initiative and said, how much more can we get? I mean, you have people now going to try to. So we went from 15 weeks, which I agreed with, to 6 weeks, which I think, I'm heartbroken, but I don't think you're pregnant at 6 weeks. Sometimes, maybe. So I'm a little afraid where we're at with that bill, but I don't want to go with this initiative that they're signing a petition for 24 weeks because I don't believe that an abortion after 24 weeks is, they want to say viable. David, I've said for me, viability is so much lower now because there are some infants that are being taken, preemies that are actually healthy children that have come out before 24 weeks.
Can you call a preemie healthy?
I mean, I'm saying they say viability. So the argument is viability.
Mm-hmm.
If I can take from the womb to life, that's what they're trying to push. And 24 weeks is right,
Right.
It's really, see, this is where it's intricate.
Mm-hmm.
It's like, would I perform an abortion at this time? The doctor says no. But I can go to my employer. And say, look, this is where I work. You need to know that this is where I work. This is where I go to.
Mm-hmm.
I don't go past this place. And if you want to fire me, you can fire me. But that's my point. There might be another doctor in there that's going to take the baby right out and then abort it.
Mm-hmm.
You just don't know.
Mm-hmm.
But there's some people that say, hell no, I'm not going to do that because I know it's viable. I'd rather take that child out of the womb and put it in the incubator and do everything I can to keep it alive.
Right. There are nuances. I agree. There are nuances, and 90% of most abortions are performed medically via medication versus medical procedure.
Again, that's another place that I don't go. I'm not Catholic,
Mm-hmm.
so I don't have such strict rules in my Protestant faith. I don't birth control. Listen, the condom. I don't. The pill, the after morning pill, all these different things. I'm not going to go attack them. I'm not going to attack them because if you at least try to prevent, I'm all about prevention, right?
Correct.
That's all I say is we have that right to make the decision early.
Mm-hmm.
Don't make a decision that you're not ready for the consequences on. That's where I've always stood with this situation. It's like, I believe I'm pro-choice when it comes to when you have sex. You have to be ready for what comes next. I don't believe you can have sex and then say, hey, you know what? Guess what? I didn't want to have a baby with you. I just really wanted you to sleep with me. Guys, they call dogs all the time. Why? Because they're always trying to get into, a place they're not supposed to be, right?
We are biological creatures.
Yeah.
So you can't take that out. We are biological creatures.
I'm not taking that out. I'm saying that's what you're going to do. Then you need to be prepared for the consequences. And rape and incest, those are totally against the law. Because they're against the law, that takes a whole different precedence to make somebody. Now, I understand our state.
Okay.
Our
state's weird on that.
I'm that Republican that does believe that rape and incest absolutely should be protected. The woman should be protected So, but
Angelina, you wanted to say something?
Oh, yes. So I just had a quick question. So if this law wasn't in place, this bill that Ron DeSantis wanted, medical providers wouldn't be able to do that. So, for an example, if I was a doctor and I didn't believe in abortion, I would still have to perform that abortion.
If you're qualified to perform that abortion, because there are specific specialties, doctors who are able to perform that procedure.
Mhm.
So, a, I believe in the public discourse, people think that, oh, I can see my general practitioner, and if I wanted an abortion, my general practitioner can do that for me. No, there are certain doctors who are licensed to do that in certain facilities, and that the scope of that is very, very small. So we're not going to see people, well, we will see people say, hey, I want to abort my child, and their general practitioner or their
practitioner.
OB-GYN say, hey, I don't perform them, but I'll refer you, or I don't perform them and I'm not going to refer you. That's where it could get kind of funky. However, there are specific providers and specific licensed facilities that perform these procedures and are allowed to do it, um, but not everyone can. So you're not going to find, a bunch of doctors saying, "No, I object to this," and blah blah blah, because it's just not their specialty. They're not licensed to do that.
Okay.
Um, Doctors take a number of oaths to cure, to prevent care. The Hippocratic Oath specifically talks about preventive care. And whether or not these oaths are taken seriously, which I hope they are by those law school students who become doctors, who receive their degrees, become new doctors, I hope they go back, they remember to do no harm. And taking the whole mental health piece into this, that medical providers do understand that making certain decisions about their own health or the health of their children or loved ones is tough, and that they think twice about the advice that they're about to give.
Thank
So, so David, I always love that you let me have this history thing. So,
Uh oh.
do you know who Salam? So you always know these answers, but do you know who Samuel Alexander Mudd Sr. is? You,
It's not the gentleman that shot Lincoln, no. The doctor who performed on Lincoln?
a doctor that was it was American physician who was imprisoned and for conspiracy with John Wilkes Booth because he set John Wilkes Booth's leg.
That's correct.
So
Okay.
concerning the assassination of Abraham Lincoln.
Mhm.
So he was arrested, and I believe later on he was executed. So um, where was this protection? I mean, conspiracy. When I
When,
say I think about things, when I say I think about things, it's like, okay, this is that slippery slope, right?
well,
This
when
is still in effect. If you do your Hippocratic oath, right?
Well, when I was, on the Underground Railroad with Harriet Tubman and got to the northern states and
Listen,
freed myself and got on that jury, I sided with his
but you
execution.
look, you get it because I mean you know who these people are. There's
Yes.
nobody learning this history. Nobody's learning this history. Where is that fine line, right? It's conspiracy is conspiracy.
And how
You know,
easy it can be crossed.
yes,
The
and
fine
it's
line.
like we have to know where that is. And this is again, I may not. I'll defend the fact that they put this law in effect, right?
Sure.
But I don't defend that the law is going to have any substance because it's going to fail because civil rights bills and all these other things will come in and say, yeah, you can't quite do it.
Mhm.
Now, private practice maybe, but the law is just not going to stand, you know,
It's pretty hard being a Republican nowadays, isn't it, Joel?
It's really interesting being a Republican nowadays and having true beliefs that you see are disappearing. So you got to get a little bit closer. Yeah. So yeah, but it's hard to be a Democrat right now too, David.
There you go. Now it's
I mean, you see your party doing the same thing.
Yeah, I
And
set aside my Democratic credentials to the side for a little bit, and I identify more as a moderate liberal
look,
now.
I hang my when I do the show, I hang them up. Honestly, I hang them up because you know what?
For
I'm
target
going to hold
practice,
I'm going to hold everybody accountable, and I'm not going to change my First Amendment, beliefs
right?
for a party for party loyalty. I'm not going to make one individual become that one that I idolize to the point where I forget that Ronald Reagan said the 11th Amendment is "Thou shalt not speak ill of another Republican," and now it's the 11th Amendment is you must do as much damage to your Republican opponent as possible so that they don't have a chance to win in the general election.
Well, we'll see that play out in the 2024 Republican nomination for president.
We're going to see quite an interesting race because with
Fun time.
DeSantis in now, with DeSantis in, Trump has already had advertisements against him. It's going to be being a Republican is going to be tough, especially in the state of Florida.
All right, Angelina, final thoughts.
I think that I'm trying to think of like how to conclude the show. um, as far as all this stuff, I think that it's just about us just having conversation. Of course, it's hard being a liberal and a conservative. Actually, at first, whenever you're talking during like the show, I'm like, he's a little bit more conservative than he thinks. And so I think it's just about us just getting together and just having these discussions and not worrying about party loyalty and just being loyal. I don't want to say to ourselves because I feel like that just sounds so narcissistic, but being loyal to our morals and our values.
All right,
Excellent.
excellent.
So I would like you to like our show. David would like you to subscribe to our show.
That notification bell.
And there you go. So thank you very much. You can't make this shit up. We
Okay.
passed a law. We passed a law that's probably never going to go anywhere, but we talked about it anyways.
All right. Thank you.
Thank you.
Bye.
This is the button right here.